their health centers to access these TB services. We are also building the capacity continuously, training of our community health promoters. We are training our clinicians and lab staff in order to maintain a thorough on-the-job mentorship, and government supports these fresher training programs. And lastly, we do domestic financing advocacy. We continue as a ministry to advocate for increased domestic financing at both national and county level. The annual TB budget for the financial year, Honorable Speaker, 2024-2025 was $136 million, of which government funding covered only 1% and donor funding 20%, leaving a 79% funding gap. We will appeal to the House, the National Assembly, which is a budget-making house, for increased resource allocation. But, Mr. Speaker, I don't want to say much, but we are talking to our colleagues under the new U.S. administration, and we are coming up with a substitute for USAID. And I think by the end of this month, the country will hear the good news. That we might not call it USAID, we might call it something else, but we are negotiating, and by the end of this month or early next month, we will find a way of how we can bring back the role USAID played, because USAID was key in this area. And then, of course, we are collaborating at a multi-sectoral level to make sure that there's accountability. And so sectors like housing, nutrition, correctional services, and labor, we are also telling them how to address the social determinants of TB. Thank you, Honorable Speaker. But just to finish, we will, through Honorable Gitau, and we will write to the House, we will ask for more allocations. But rest be assured that TB control will closely linked to poverty, it's closely linked to poor housing, it's closely linked to poor nutrition, and that's why we have to adopt a multi-sectoral approach and talk to other stakeholders for accountability framework. Thank you, Mr. Speaker.
Faith Gitau, you're satisfied?
Thank you, Honorable Speaker. I want to confirm to the Minister that we have no TB drugs in Nyandarua, and most of the hospitals around, in Kenya, do not have these drugs. Please, you have said that you're providing free of charge. When do we expect these drugs in our hospitals?
Minister.
Honorable Speaker, I was in Nyandarua 3 weeks ago. I want to confirm to the House there are plenty of TB drugs in Nyandarua. And I am ready to send my officers to Nyandarua with the Honorable Member to go and verify. I am ready, Honorable Speaker. I cannot lie to this House. The TB drugs are available in Nyandarua County, in all the hospitals, and I'm ready, under your direction, that the Director General of Health, approved by this House, is here. I will dispatch him to Nyandarua tomorrow and to confirm to the Honorable Member.
Fair enough. Kagusha.
Thank you, Honorable Speaker. Could the Cabinet Secretary in charge of health clarify whether there is an outstanding debt amounting to Kenya shillings 450 million shillings owed to Consolata Hospital, Mathari, and of course 433 million to Nyeri County Hospitals, including 36.7 million for Mukurweini Hospital and 236 million for Tumutumu Hospitals.
That is
and this comprising
of Kagusha. That's not your question. You are not allowed to go beyond what is on the order paper. So just read out your question. You can ask those other figures in your supplementary.
Thank you, Honorable Speaker. And this amount comprising of arrears accumulated at the National Hospital Insurance Fund and payments for the Social Health Authority, that is NHIF and SHA. Number two, state the factors contributing to the prolonged delay in remitting payments to Consolata Hospital Mathari despite the provision of health services to patients. Of course, Honorable Speaker, I would like just to note that the fraudulent payments in millions have also been made to dysgenious hospitals, while genuine ones are missing out. Honorable Speaker, number 3, outline the measures put in place to ensure the debt owed to the hospital is promptly settled and its operations fully restored. Number 4, provide a timeline for the payment of the arrears and dues accumulated from October 2024 to April 2025 to Consolata Hospital, Mathari, by SHA. Thank you, Honorable Speaker.
Minister.
Honorable Speaker, on Consolata Hospital, Mathari, I first want to clarify that the NHIF legacy debt, and that is one of the problems, biggest problem that we are facing as a country, and which is making the implementation of the Social Health Authority a bit bumpy, because many of the questions that are raised on debt are on the legacy debt of NHIF. As of 30th September 2024, when this House enacted the new Social Health Authority Act, the NHIF liability owed to Consolata Mathari Hospital stood at 153 million. This facility falls under the category of health providers owed amount exceeding 10 million shillings and is subject to verification and validation process as mandated both by law, by the Constitution, by the PFM Act, and by the presidential directive prior to any payment being made. So, Honorable Speaker, and I've attached the letter that Kenyans who are owed between 1 shilling to 10 million of the former NHIF debt, amounting to 5.3 billion, accounting for 92-93%, will be settled. And I've written to the Minister for National Treasury, and I'll table the letter, that he puts it in the supplementary estimates. And currently, Honorable Speaker, using the audit, pending verification audit led by the former Auditor General and the leadership of Social Health Authority, we are auditing and we are verifying and validating all the pending bills of NHIF. On SHA payment status for Consolata and outstanding payment, the overall SHA settlement rate for all our faith-based organization facilities, whose their bills and invoices and claims have been verified, reviewed, clinically checked, and are ready for payment and paid, is standing at 65% as of today. Consolata Hospital Mathari will receive 29 million